You know that feeling, maybe after a really heavy night out, perhaps skipped a few meals, just feel completely awful? Well, what might seem like just a really bad hangover could actually be your body signaling something, well, much more serious, alcoholic ketoacidosis, or AKA.
That's exactly right.
Mm.
And in this deep dive, we're going to really get into AKA. Think of this as your focused revision session, hitting all the key points you need to understand about this pretty important metabolic issue.
Yeah, we've basically pulled together the key info from medical revision notes.
Mm.
The goal is to extract the really critical knowledge, explain it clearly, make it memorable, without getting bogged down in too much detail. We'll flag memory tips too and why this stuff actually matters.
And I'm here to maybe offer some deeper insights, connect a few dots, and help make sense of the underlying mechanisms.
Okay, great. So let's jump right in. What exactly is alcoholic ketoacidosis?
Okay, so simply put, AKA is a metabolic disorder. We tend to see it in people with a history of, chronic heavy alcohol use. The main problem is the liver's usual process for handling fats gets messed up.
Messed up how?
Well, it leads to an overproduction of these things called ketone bodies, and that results in the blood becoming too acidic. That's the ketoacidosis part.
Right, so it's this buildup of ketones that's the issue. What are the key characteristics that help us spot AKA?
The main things we look for are these ketones in the blood, but, and this is important, alongside blood sugar levels that are either normal or maybe even low. So non-diabetic euglycemia with ketoacidosis.
Uh-huh.
It's really key to remember we generally don't see the high blood sugar you get with, say, diabetic ketoacidosis.
Right, okay. So that normal or low glucose, despite the ketones, that's a really crucial difference from DKA. What usually triggers this? What kicks it off?
Typically, it involves, well, significant alcohol intake, often combined with poor nutrition,
Mm.
specifically not eating enough, sometimes even bordering on starvation.
Yeah, you can imagine someone on a heavy drinking session, they're probably not thinking about balanced meals, are they?
Exactly. That combination is classic.
And this isn't something you can just, sleep off. It needs proper medical help.
Oh, absolutely. AKA is serious.
Yeah.
It needs to be diagnosed and treated promptly to avoid serious complications.
Understood. Okay, quick memory aid time. How can we easily lock in what AKA is and who gets it?
The acronym itself is pretty helpful, actually. A for alcohol, obviously linked to alcohol abuse. K for ketones, the buildup we talked about. And A, again, for acidosis, the blood becoming acidic. And just remember, it's primarily in those with that chronic alcohol misuse history.
AKA alcohol ketones acidosis. Got it. That works. Okay, let's dig into the why now. What's the sequence of events? How does it happen?
Right, so it usually kicks off with excessive alcohol consumption. This heavy drinking can trick the liver metabolically. It starts acting like the body is starving.
Okay.
So as a result, the body's fat stores, adipose tissue, start breaking down and releasing fatty acids into the blood.
Okay, so fatty acids are released. What happens then, especially if someone's not eating properly?
Well, if there aren't enough carbohydrates coming in, the liver loses its preferred fuel. Carbs are really important for how the liver normally processes fats. So without enough carbs, the liver switches gears and starts breaking down these fatty acids using an alternative pathway. And that process leads to the overproduction of ketones.
Okay. And it's not just the lack of food, is it? Alcohol itself plays a direct role.
It absolutely does. Alcohol can interfere with insulin secretion and how the body uses insulin. Insulin normally helps manage blood sugar, but it also plays a role in fatty acid metabolism. So alcohol basically throws another spanner in the works, worsening the whole metabolic mess.
Wow. So it's the heavy drinking causing that starvation state and messing with normal metabolism, plus alcohol hitting insulin function. It really creates a perfect storm for ketone production. Okay, here's something for you listening to think about. How might someone who drinks heavily just unintentionally stop eating much? And how could that specific combination start the AKA ball rolling?
Yeah, good question to ponder. Now, thinking about susceptibility. Who is most at risk for developing AKA? What are those key risk factors?
Well, based on what we've said, chronic alcohol abuse, long-term heavy drinking, that's got to be number one, right?
Absolutely, top of the list.
Yeah.
And very closely linked, as you'd expect, is malnutrition. If someone isn't getting enough nutrition, maybe because of those erratic eating patterns that often go with heavy drinking, their body's already vulnerable.
Makes sense. And we mentioned reduced carb intake being important for the liver, so that's another clear risk factor. What about patterns of drinking? Does that matter?
Yeah, it does. Binge drinking, so
Mm.
large amounts in a short time that can definitely trigger an episode. Also, people with a history of alcohol dependence, especially if they go through cycles of heavy drinking, then cutting back or withdrawing, they seem to be at higher risk too.
Okay, maybe a memory tip here. Try picturing someone struggling with alcohol dependence. They might skip meals, drink heavily in binges, and over time, their body just gets more and more susceptible to this kind of metabolic stress.
Good visual. Okay, let's get a bit deeper into the pathophysiology. What's actually going wrong inside the body, metabolically speaking?
We've touched on it, but yeah, let's break down that core disturbance. It's all about how the liver handles fatty acids going wrong, isn't it?
Precisely. That impairment, driven by both the chronic alcohol and the poor nutrition, it causes the liver to churn out way too many ketone bodies.
Mm.
The main ones are acetone, acetoacetate, and beta-hydroxybutyrate.
And the direct result of producing all these extra ketones?
They just build up in the bloodstream. So you get elevated blood ketone levels.
Mm.
And because ketones are acidic by nature, this increased concentration causes metabolic acidosis. The blood pH drops, becomes too acidic.
Too many ketones, blood gets too acidic.
Yeah.
Simple as that. Can you give us a quick analogy maybe to help picture it?
Yeah, okay. Think of the liver like a factory. Normally, it processes fuel really efficiently. But with heavy alcohol and not enough food, it's like you're feeding it the wrong fuel and not enough of the right kind. It just gums up the works. And the result is it starts producing this toxic byproduct, the ketones, which build up, disrupt the whole system, and make everything acidic.
That helps, yeah. The gummed up factory analogy. Okay. So when a patient comes in looking like this, what else might be going on? What other conditions do doctors need to rule out? The differential diagnosis.
Right. Differentials are key here. The absolute big one to distinguish AKA from is diabetic ketoacidosis, DKA. And the crucial difference, as we keep saying, is the blood glucose.
High in DKA.
Exactly. High in DKA. Whereas in AKA, it's usually normal or even low. That's the first major checkpoint.
So checking blood sugar is step one and telling them apart. What else is on the list?
Starvation ketoacidosis is another one that can happen with prolonged fasting, severe calorie restriction. Yeah. But it's generally not as severe as AKA, and you wouldn't typically have that history of chronic alcohol abuse alongside it.
Right. Any broader categories?
Yeah. You'd also think about other causes of metabolic acidosis more generally. Things like lactic acidosis, maybe kidney failure, certain toxic ingestions like methanol or ethylene glycol. But usually, the patient's story, especially the heavy alcohol use combined with the lab results, particularly the glucose and ketones, points pretty strongly towards AKA.
So really nailing that glucose level is vital for separating AKA and DKA. Now, shifting gears slightly, how common is AKA? Do we know much about its prevalence?
It's actually tricky. The exact prevalence, say, in the UK isn't that well defined. What we do know is that it primarily affects people with chronic alcohol abuse issues.
So you'd guess it's more common where alcoholism rates are higher?
That's the logical inference, yeah. The incidence is likely higher in those populations.
Okay, so maybe the exact numbers aren't there, but for anyone listening, the takeaway is be aware of this condition in individuals who have a history of significant alcohol misuse. Definitely keep it on the radar. Now, let's paint a picture. What does a patient with AKA actually look like? What signs and symptoms might we see?
Well, they can present with quite a mix. Abdominal pain, nausea, vomiting, those are really common. Dehydration is usually pretty evident too. And a characteristic thing you might notice is sort of fruity or sweet smell on their breath. That's the acetone, one of the ketones being breathed out.
Okay. What about their vitals? How might they seem generally?
You often see tachycardia, a fast heart rate, and sometimes hypotension, low blood pressure, largely due to the dehydration. Altered mental status is also possible, ranging from confusion or drowsiness to being quite disoriented.
Right.
And a classic sign of the ketoacidosis itself is that deep, rapid breathing pattern. Small respirations. It's the body trying desperately to blow off the excess acid as carbon dioxide.
So a cluster of things: GI upset, dehydration signs, that fruity breath, maybe confusion, and the breathing pattern. Is there a typical pattern in their blood test that confirms it?
Yes, definitely. The lab results are key. You'll see metabolic acidosis on a blood gas analysis, usually with an elevated anion gap, which helps confirm the type of acidosis. You'll find elevated ketone levels in the blood or urine. And, crucially, that blood glucose will be normal or low.
Good time for another memory tip. Maybe think of the symptoms as the body just screaming for help due to the toxic ketones and lack of fuel. How about gut rot, gaspy, glucose low, gone fuzzy? Gut rot for the nausea, vomiting, pain, gaspy for the small breathing, glucose low is self-explanatory, and gone fuzzy for the altered mental state.
I like it. Gut rot, gaspy, glucose low, gone fuzzy, catchy and covers the bases. So if we suspect AKA based on all this, what investigations do we absolutely need to run?
Blood tests are central, I'm guessing.
Absolutely central. We need to check their electrolytes, sodium, potassium, chloride, bicarbonate, because they could be all over the place. Critically measure the blood glucose to rule DKA in or out. We need to measure the ketone levels directly if possible. And then arterial or venous blood gases to assess the acid-base status properly, pH, bicarb, CO2, to confirm that metabolic acidosis.
Right, so those tests nail the diagnosis and rule out the other big contenders. Once AKA is confirmed, how do we manage it? What's the plan?
The main focus is twofold. Correct those metabolic imbalances we've talked about and provide really good supportive care to get the patient stable.
And what are the absolute must-do treatment steps?
Okay, number one, intravenous fluids. Aggressive fluid resuscitation is vital to fix the dehydration. Number two, electrolyte replacement. Potassium is often low and needs careful replacement. We also need to correct the acidosis.
How do you do that?
Often, the fluids and stopping the ketone production are enough. The body can usually buffer the acid once the underlying process stops. In really severe acidosis, bicarbonate might be considered, but that's usually done consciously and often isn't needed.
Okay. What else is critical?
Thiamine.
Yeah.
Absolutely crucial. Given the alcohol abuse history and malnutrition, these patients are in high risk of thiamine deficiency. Giving 5-ethiamine, often before glucose if you give glucose, is essential to prevent serious neurological problems like Wernicke's encephalopathy or Korsakoff syndrome.
Right, thiamine first is a key point. Anything else?
Well, managing any other complications or coexisting medical issues they might have, and then thinking longer term.
Yeah, what about beyond the immediate crisis?
It's vital to address the underlying alcohol dependence. That means starting conversations about alcohol cessation, offering support, maybe referral to specialist services. Otherwise, it's likely to happen again.
Absolutely. So a crucial treatment point to remember. Start 4V saline and IV thiamine promptly if you suspect AKA. Don't delay. Now, what's the outlook usually like for these patients? The prognosis?
Generally, it's good. If it's caught early and treated properly with fluids, thiamine, electrolyte correction, most people recover well. However,
So always a however.
yeah,
Yeah.
if diagnosis is delayed or if treatment isn't adequate, things can go badly wrong. It can lead to serious complications, and sadly, it can even be fatal.
What kind of things influence how well someone does?
Several factors. Their overall health before the episode matters, how well they stick to the treatment plan in hospital, and then, really importantly, their ability and willingness to tackle the underlying alcohol problem long term. That's probably the biggest factor in preventing recurrence.
So the message is hopeful overall. With the right care and addressing the root cause, recovery is definitely the expected outcome. But what are those serious complications we mentioned? What can happen if things go wrong?
Well, the severe dehydration can lead to hypovolemic shock. The severe acidosis can cause respiratory distress or failure. Electrolyte imbalances, especially with potassium, can trigger dangerous cardiac arrhythmias.
Okay.
You can also get acute kidney injury, often because of the dehydration and poor blood flow. And, as mentioned, in the most severe untreated cases, it can unfortunately lead to death.
Right. So
Yeah.
the key takeaway there is just how critical prompt and appropriate medical intervention really is. It prevents these really severe outcomes.
Exactly. So let's just quickly summarize. AKA, metabolic disorder, chronic alcohol abusers, ketone buildup due to messed up fat metabolism, remember?
Yeah.
Low or normal glucose, high ketones, metabolic acidosis, causes, alcohol plus malnutrition, treatment. Fluids and thiamine are cornerstones.
Understanding all that is just so vital, both for revision and for recognizing this in practice. Okay, let's leave our listeners with a final thought. Thinking bigger picture. What kind of societal factors do you think contribute to chronic alcohol abuse in the first place? And how might tackling those issues actually impact how often we see conditions like AKA?
That's a huge, important question, isn't it? Really broadens the perspective beyond just the metabolic pathways. And for you listening, we really encourage you to keep exploring this, keep thinking about it, solidify your understanding. And don't forget, for more great resources for your MSRA prep, definitely check out pastmsra.com and also freemsra.com.
Thanks for joining us for this deep dive. We'll catch you in the next one.